The first topic for Anatomy and Physiology 2, as we teach it at this institution, is often referred to as special senses. I'm referring to this section just to sensory systems because I want to go beyond just special senses. Now, the special senses are those senses that we associate with a particular organ structure, such as vision with the eye, audition with the inner ear, or olfaction with the nose, those sorts of senses. The other senses are what we call general senses, which are spread across multiple organ systems. The most obvious of the general senses is somatosensation, what often is referred to as the sense of touch, although it is much more than that. That's spread across the skin or integumentary system, probably the primary organ associated with it, but also, especially for the proprioceptive sensations associated with that sensory system, it's going to include the skeletal muscles, joints, tendons, those sorts of structures. So all of those organs contribute to somatosensation. Other general senses are going to be those that are associated with other organ systems. More often those are non-somatic senses or visceral senses, autonomic senses, however you want to refer to that. Those would be things such as distension of the stomach or the bladder, or stretch in the walls of the blood vessels for blood pressure, not that we have a conscious perception of that particular sensation. But those would be categorized as visceral or autonomic general senses. While we want to consider both types of sensation, we will concentrate on the special senses because a lot is known about that, and they're obviously the more interesting topics for this course. We will especially look at the inner ear and the eye in some detail, as those are the special senses that we want to usually pay the most attention to. So before we get into those special senses, I want to talk about a few things having to do with sensation in general. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer.